Thank you all for joining, and thank you, Anna, for sort of helping set this up and sort of collaborating on this webinar. So as Anna introduced in the beginning, we are here today to talk about healthcare and life science in Hong Kong, but in Hong Kong also in this sort of greater perspective in the sense of Greater Bay Area. Given everything that's happening over here with integration and the work's being done, there are a lot of synergies and opportunities that then can happen across the border with Hong Kong as a sort of stepping stone into the southern part of mainland China. We'll go back into sort of the Greater Bay Area, what that is in a little bit, and also walk through this. So the agenda you see on the slide on the screen now, first introducing a bit Hong Kong and the Greater Bay Area, what it is, and a bit sort of the background, also from a Swedish company perspective. But then Stacey will go through the main bulk of this discussion today, looking at the cross-border healthcare, what is happening, a bit more focus on the aging population, and of course also what opportunities that can bring for Swedish companies who operate in that space, if it is through medical equipment, pharmaceuticals, or what have you. But before that, we can just do a brief introduction of ourselves, so you know a bit who we are. My name is Johan Ture. I am responsible for the operations of Business Sweden over here in Hong Kong. But in that also comes the sort of operational coverage of the Greater Bay Area, so Macau and Guangdong as well, including Shenzhen. And I've been here now in Hong Kong since August last year, but was before that working up in Beijing for a bit more than 3 years. So I have experience from both sides of the border, but as mentioned now since summer last year down here in Hong Kong. And with me today I have my colleague Stacey. I'm not sure if you want to say a few words about yourself as well, Stacey.
Yep, thank you, Johan. So I'm Stacey, born and raised in Hong Kong. So I'm actually the senior consultant at Hong Kong office. So I have been with Business Sweden for almost 5 years. So one of my key focus is the healthcare industry. So that I have led the healthcare delegation last year, actually. Healthcare is actually one of my key focus. So maybe now Johan will walk us through when come to the Hong Kong and GBA introductions.
Yes. So thank you, Stacey. So if you go to the next slide. Bit more about sort of who we are as an organization. This is not going to be a long corporate presentation, don't worry. But Stacey and I work with Business Sweden, so the Swedish Trade and Invest Council, who our purpose is to help Swedish companies grow global sales and also international companies invest and expand in Sweden. Not going to go through all the information on the slide, but simply put, we are and have offices more or less where Swedish companies need us. And if we don't have offices there ourselves, we have coverage from nearby offices instead. We are very local in our global operations. So as you see here, both me and Stacey are in the call. Hence the sort of very strong local footprint with colleagues mainly from the markets where we operate. A few of the industries you see on the bottom right, one of them is life science. So we have also a team in Stockholm working with this sort of supporting and helping navigate from a more global context, the Swedish companies back home. If you go to the next slide, Stacey, you can just zoom in a little bit more. And when it comes to the Asia region or APAC, a lot of things are happening over here across industries. There's a lot of development in the area, not only from a population perspective, but of course from a GDP and investment perspective. Because as the area here becomes richer, in essence, the middle class is growing. It puts increased pressure and on the sort of infrastructure, on the healthcare system, etc., across the markets. And of course, this leads to additional opportunities for Swedish companies coming and support in this transition. So that is a trend we see across the region. And when it comes to healthcare, we have various type of programs across a few of these markets, if not most of them. So if you've been in contact with us in Business Sweden before, when it comes to Asia, you have most likely talked to at least one of our colleagues in these markets. But today we focus more on Hong Kong. We have an office also in Shenzhen that is operational under us here. So we have that sort of double coverage down here in the Greater Bay Area. But if you go to the next slide, Stacy, I think we can go away a bit from Business Sweden and more talk about the area here. And before we go into what is happening from a more specific healthcare and life science and sort of aging population perspective, we just want to talk a bit about Hong Kong, what it is, a bit focused on the healthcare side, but a bit of a snapshot. So Hong Kong is a market. It's a special administrative region in China, but it is a separate market from a sort of customs perspective and from a visa perspective and so on. And what's interesting about Hong Kong is that it is a sort of one city market, similar to Singapore and Monaco and so on, with 7.5 million people, which makes it also the fourth most densely populated economy in the world, with 6,910 people per square kilometers. You see on the top left here the map of Hong Kong, the sort of geography. But what's worth mentioning here is that we have not sort of added in where people live, because people are more or less concentrated in the central areas of that map, which means that, as Stace will talk about a bit later, of course, from a healthcare and sort of services perspective, it puts pressure on the system as people get older, and as sort of you need to care them in an efficient way with X number of hospital beds, etc., that you have. But just some stats here about Hong Kong as well. First in the world for life expectancy, the second most efficient city. This according to a healthcare efficiency benchmark of Bloomberg from 2020. So it's a bit aged, but at the same time it shows a bit the sort of level of the healthcare system here in Hong Kong, generally speaking. It's the third largest pharmaceutical hub in Asia. It is ranked very high when it comes to biotech funding, according to Hong Kong Stock Exchange here from 2021. And also now for 2025, 2 of the medical faculties in QS World University Rankings are here in Hong Kong. So all of these are sort of rankings for a one city market in essence. On the bottom right here, you also see the total value of imported medical equipment. What's worth noting though is Hong Kong is a import and re-export economy. So that this does not mean that everything stays in Hong Kong, but it does mean, of course, that it is, as mentioned, a gateway, for example, into mainland China, but also out of mainland China. If you go to the next slide, Stacy. Yes. So just a bit more sort of data introduction to Hong Kong as a market. As I mentioned on the previous slide, it is an import and re-exported oriented economy. It is sort of what it is known for, a hub, logistical hub. But when it comes to what it's also known for in the market itself, it has a very simple regulatory environment with no specific legislative control here when it comes to, for example, medical devices, which makes it a sort of an easier market to enter from a life science and healthcare perspective. And this is also something that sort of influences a bit when it comes to the Greater Bay Area and the opportunities that come there to that area from Hong Kong. It is characterized by free trade, low taxation, and also low government intervention in general, and has no tariffs, VAT, and import quotas. So given all that and other parts, it is the world's 10th largest trading economy, with mainland China as the most significant trading partner, again, primarily from the import and re-export perspective. But with all this said, I mean, this is just generally about Hong Kong, but what we also see here on the right-hand side, we in Business Sweden do annually what's called a business climate survey across most markets that we operate in. And I think that as of this year, we do it across all markets we operate in, where we ask Swedish companies what they believe and what they feel about the business climate in the markets from a various different angles. And what we do see here is that for Hong Kong, it is quite positive. 3.0 would be average. And the business climate took a hit during COVID. I'm sure most markets did, but Hong Kong, similar to mainland China, got hit quite hard when it came to lockdowns, when it came to sort of the control that was put. So it took a severe hit here. But what some of these sort of key advantages mentioned by Swedish companies for Hong Kong are exactly this: the gateway from mainland China, access to key customers and business partners, and the free market economy. And this is across sectors, including the life science and similar. I just want to mention here as well that we are finishing up the business climate survey for Hong Kong now for 2025. and there will be a webinar on this on June 13th. So unfortunately, we are not able to show the data for that here, but we will have data also in a report that is published online in the very near term. If you go to the next slide, Stacy. So when it comes to Hong Kong, it is an interesting market in itself. As mentioned, it's 7 million plus people living here. It has a lot of positive benefits from operating business and so on. But at the same time, it is a one city market. But what is important to think of when it comes to Hong Kong is that it is part of a bigger setup. With integration to the Greater Bay Area, the Hong Kong sort of economy is sort of merged into the broader picture, which means that companies operating in Hong Kong can also then tap into the sort of broader economy that comes with this. The integration aims here on the right-hand side, non-exhaustive, are enhanced connectivity between, for example, Shenzhen and Hong Kong. It's a 15-minute train ride, 1-5, or I think it's 1 hour subway from the center of Hong Kong to Shenzhen railway station. So a lot of work is being done here on the connectivity, for example, from a people perspective. But this also increases talent exchange both ways, which makes it easier to get access to talent, especially the mainland ones. But also another aim here is when it comes to flow of capital between Hong Kong and the Greater Bay Area. So Hong Kong is by itself, as I mentioned before, a special administrative region of China, and is operating under what's called one country, two systems, which means that the Hong Kong system is sort of separate from the mainland China one. And this means that, for example, in Hong Kong, they use a common law and not the Chinese ones. It's a simple taxation system. Chinese and English are official languages. And also the Hong Kong dollar is separate from the Chinese renminbi and is also pegged to the USD, which makes it sort of stable in a different sense than the Chinese one. The Great Bay Area operates under mainland China as sort of as the other parts except for Hong Kong, Macau then, with its own systems. So this is quite interesting as sort of this integration happens, this two-system approach still remains. And that means that companies that have a business in Hong Kong still operate under the Hong Kong system, even though you might have partners on the mainland side that you go do business with, for example. If you go to the next slide, Stacy. Yes. So what this means then, the integration, is that you, by operating or working in Hong Kong, you get access to the bigger part. And this means, for example, from a population perspective, you go from 7-point-something million inhabitants to 86.9. From a GDP perspective, it's $381 billion up to almost 2,000. So there's a lot of extra benefits that are gained here. And when it comes to this region, as you see on the bottom left, the GDP, 1/9 of the Chinese GDP is in this region, and the GDP of it also surpassed that of South Korea. So it's a huge sort of economy that exists down here in the sort of southern part of China. And from a medical perspective, also, it's quite interesting that 1/5 of the listed medical companies in China are from this region. So it is, in that sense, sort of also a hub for and cluster for the medical systems. You see on the right-hand side here a few of the sort of different characteristics of the various cities and markets in the Greater Bay Area and how they sort of tap into the healthcare side. I'm not going to go through all of them in detail because, of course, they all have different characteristics and you can always double-click more. But for example, Hong Kong here is the international cross-border exchange and, in a way, transformation center of the biomedicine technology and international financing center for biotech. So Hong Kong has a sort of strong role in this region, and companies such as, for example, AstraZeneca are setting up a big center down here as well. So there's a lot of focus also from the government on this space here in Hong Kong. And Stacey will get back to that in just a little bit now as well. So with that quite short introduction to Hong Kong and the Great Bay Area, I want to hand over to Stacey to walk through a bit more what is happening down here when it comes to healthcare and also the aging population and the implications of that on the opportunities here with Swedish companies.
Yeah, thank you, Johan, for the great introductions about the Hong Kong and also the Greater Bay Area introduction. So now I will be taking you guys to the key topic today, the cross-border healthcare for the aging populations. So first, we will look at to the healthcare macro data or the indicator for the Hong Kong market first. So Hong Kong health sector actually stand at a pivotal moment. So as you can see in the graph, so the Hong Kong health sector's healthcare is actually the largest government spending in the government budget, accounting for 30% every year. And as you can see that actually it is growing very significantly over the past few years. And in Hong Kong, one of the key reasons when it comes to this large budget is that the Hong Kong healthcare is public healthcare is heavily subsidized by the Hong Kong government. The public sectors actually take account 95% of the total demand in the market. So currently in Hong Kong, there are 43 hospitals offering around 30,000 beds, and then in there is also 14 private hospitals in the market. So for this large spending, basically it's just largely driven by the fact that the healthcare system is actually not only heavily subsidized by the Hong Kong government, and also the Hong Kong government is also investing heavily when it comes to the infrastructure building and also expanding its capacities. So now we are looking at what's happening in the market. So there is two sides. Not only we actually first observed that not only the public side is actually investing heavily, the private side also have a very aggressive expansion plan. So in Hong Kong, we have already started a 10 years hospital plan. So it has already started and it is expected to be in full completion by 2023. So in the few coming years that we can foresee that there will be some of the procurement demand coming up from the hospital expansion and also the newly built hospital and some of the hospital redevelopment. So currently, the Hong Kong government is also under reviewing the second 10 years hospital development plan. So for this plan, that will be involving a 207 million investment covering 19 projects. So expected to add a 9,000 bed from this development. On the other side, the Hong Kong government is also planning for the third medical schools. They are actually under the proposal stage. So that we can see that the Hong Kong government, they actually have a very aggressive expansion plan when it comes to the medical infrastructure upgrade and also expansion. When it comes to the private side, so that recently there have been 4 private hospitals that has announced a redevelopment plan to enlarge their capacity, namely the Baptist Hospital, Adventist Hospital, Avigo Hospital, and the Hong Kong Charity Hospital, the Precious Blood Hospital. So this hospital have announced it this year for expansion plan, so that we also see there will be an increasing procurement demand for the market. So why the private and public sector, we are actually increasing so heavily and aggressively in the market? So the primary reason is that basically is the demographic challenge in Hong Kong, the aging population. Well, the aging population is not only the problem in Hong Kong, probably in the world, but that Hong Kong, we are actually at a very critical stage right now. According to the Hong Kong government forecaster, there will be 2.5 million people that will be over the age of 65 by 2039. So it's not actually, it's just not long ahead. So by that time, over around 30% of the total populations will be in age 65. What is actually usually in common with the aging population is the increase in the chronic disease. So according to the forecast that by 2039, around 36.6% of the population, so around 3 million of the population will be suffering from the chronic disease. So actually in the past years, according to the hospital authority data, that we also see that when it comes to specialist outpatients, it actually hit 8-year peaks with over 8 million of attendance. So among these attendants, actually around 43% of them are actually coming from the elderly demand. So as what we can see is that we are actually in a very critical landscape when it comes to the demographic changes. So what is actually when we actually have more and more elderly that are in the community, we need the residential healthcare services as well to meet the demand. So in the left-hand side, as we can see in the graph, currently in 2033, we have around 79,000 of the residential care services. So if you actually do a little bit calculation here when it comes to percentage and proportion, so definitely this is not meeting our future demand. And according to the GEL press release, that in Hong Kong, we are short of 60,000 of elderly places by 2033. So basically it's around like 7 years ahead. So we are actually lack of the infrastructure to meet the demand challenged by the aging populations. So underneath these aging populations, there are actually two major challenges in the Hong Kong when it comes to the healthcare system. The first is the high living cost, and the second is the medical shortage with the surging demand. So the high living cost, that they're always saying that beside the apartment, the apartment cost, the housing cost in Hong Kong, the other thing that is very unaffordable sometimes is the private healthcare thing, the private healthcare. So according to a survey by the Hong Kong Council of Social Services, the average living expenses is actually 25,000 for the retirees in Hong Kong. And then actually it's actually 4 times when it compared to the across the border, the Greater Bay Area, which is actually around 6,000 Hong Kong dollar. So maybe I would just give a little bit like personal experience here when it comes to especially medical costs is actually one of the largest spending when it comes to this living expenses. So according to the CWTW Global Medical Service, there are 9.8% increase when it comes to the medical cost in Hong Kong. So that I would just give a little bit like maybe other personal experiences that. So I have a family member that have been admitted to the hospital for a surgery in a private hospital. So for a 4 days attendance for a surgery in a private hospital. So basically the total bill is actually amounting for 300,000. So basically what you can see that the cost in Hong Kong is really high. And recently the Hong Kong authority, they have also made an adjustment when it comes to the fee to increase for a percentage when it comes to the outpatient, especially outpatient and also inpatient bed services. So they have been raising for some of the adjusting in the fee. So that are resulting in a little bit higher fee when it comes to the public healthcare. But of course, that is still very affordable. Even they have adjusted to the new fee compared to the private healthcare in Hong Kong. And then the second thing is that beyond the high living costs, the high medical costs and high living costs, it's the medical shortage with the surging demand. So the reason that the Hong Kong government is actually planning for the 3rd medical school is basically we are fall short of the medical professionals. According to the Health Bureau data, that Hong Kong, we actually have 2.1 doctor per 1,000 of inhabitants, compared to Sweden, which is 4.5 doctor per 1,000 of inhabitants. So basically, if you compare to Sweden, we are actually 50% behind when it comes to the doctor ratios. So that we can actually see that we are suffering for a very inadequate medical professionals. The second thing is that when we have very short supply when it comes to the medical professional, that will be resulting in a very long waiting hour for the patient to receive their medical care. So according to the hospital authority data for the ophthalmology new cases, so the waiting time is actually average for 102 weeks. So averaging for a new patient to receive their first doctor consultation, they have to wait up to 2 years. And then for the treatment for total joint replacement, which is actually, I would say that it's kind of like a very kind of common surgery for a lot of elderly. So that basically the waiting time can take up to 74 months. So basically around 300 weeks. So besides for the doctor consultation, the medical treatment, the other thing is that when it comes to the subsidized residential care services, so up to February 2023, there are actually 16,600 applicants in the central waiting list. So they're still waiting to receive this kind of care services from the government. So as we can see that here, this problem will actually get more serious and serious as we have more elderly in the society. And if we don't step in now and to tackle the problem, then the Hong Kong healthcare will be definitely in a crisis. So definitely the Hong Kong government is looking way to solve the problem. However, when the building of infrastructures, hospital, and the nurturing talents actually take time, thanks to the breakthrough of the technology, so that we are finding way through technology and the shifting demand to actually solve the problem. So that thanks to the technology, the government is actually trying to look into a way to develop the smart care to enhance the efficiency, as well as the patient experiences, and also to lessen the manpower and resources demand. So for example, they are actively looking for technology that can enable, for example, data-driven care to support them for the decision clinical support for early detection to monitoring the whole systems in order for them to streamline the healthcare management and also to fasten their waiting line. They're also trying to develop the smart ward, smart clinic, and the smart pharmacy, for example, providing the real-time information, monitoring, and to streamlining the appointment. Like, for example, nowadays they have developed this HA Go application, which is actually the patient can actually download the apps and then they can make their payment, they can make their appointment through the app. So that is actually streamline some of their manpower resources to facilitate the patient management. And then during COVID, so basically we have also developed this kind of medication delivery, so that the SF Express, they actually have this kind of same day delivery, so that to enable the delivery from door to door to lessen the demand, the waiting line. When it comes to the remote care, so that basically as of October 2024, there are actually more than 250,000 teleconsultations have been conducted in Hong Kong. And so that because they are also trying to shift the waiting line to do this kind of like more remote consultation, then they, to actually shorten the waiting line, so that they are actually finding first is the technology way to tackle this problem. And then the second is that they are also looking for way to shift. On the other hand, they are also trying to shift our demand to our neighboring cities. So where we actually foresee that the cross-border medical tourism are expanding, fueled by the Hong Kong government policy and also the growing citizen demand. So that basically, according to the Shenzhen government data, Shenzhen actually provides 700 cases of the medical treatment for the Hong Kong citizen in 2023. And this is actually on a rising trend, as what we can see. So according to a survey that conducted by Youth Idea, which is actually a youth institute, research institute in Hong Kong, so that around 30% of the respondents in this study actually received the medical treatment in China before. And then the key reason for them is actually coherent of what we have said. So the primary reason is that they have a lower cost to receive the treatment in China. And then the second thing is that they have a much shorter waiting time if they actually go across the border to receive the treatment. And then, so where are they going when they actually going to receive this cross-border medical treatment? Is that primarily is our nearest Chinese city, Shenzhen. So 90% of the people that who have received the medical treatment in China, they have actually flown into the China. And then the second is also Guangzhou. This is also, I would say that very reasonable, because I would say that they are the top tier cities in China. So where the most of the medical researchers align into, so that they have the much better medical resources in the leading cities. So next, we will look into what are the pull factor of the Greater Bay Areas, basically when it comes to the proximity and also the lower living cost. So as what Johan have mentioned already, that with the improved connectivity, so it only takes 15 minutes high-speed train to Shenzhen. And then in Shenzhen that they actually have free metro and buses ride. And then the lowering transport costs and the well-built connectivities and actually have fostered the people have flowing into the China. And also a lot of Hong Kong residents, they actually originate from the Guangdong provinces. So we actually provide them this kind of cultural roots. But of course, one of the key reasons is basically when it comes to the lower living costs and with a better living quality. So that if you actually see in the graph on the right-hand side, that we can actually see the Hong Kong residents that are usually staying in the Guangdong province has actually raised quite a bit compared to 2013. So in 2013, there are only around 67,000 of people living in Guangdong, but in 2023, there are around 88,000 of people that are living in Guangdong over the age of, this is actually for the people that are age 65 or above. And then as you can also see that the Hong Kong recipient of the Social Security allowance, so that this is actually a scheme by the Hong Kong government to allow the Hong Kong citizen to still receiving the Hong Kong social welfare, even they are living in Guangdong. So that if you compare to, it's actually seeing quite a high jump. So by 2025, so basically this the financial year just ended. So basically it's a data for 2024. So it's actually 25,000 of the elderly recipients of the Social Security allowance in Hong Kong. And also according to a survey by the Hong Kong Council, is that there are very large the frequency of the northbound consumptions are where people travel northbound for consumption is actually around 16% of the respondents actually they will spend once a week in Shenzhen or across the border for consumption. So that as you can see that like the Hong Kong residents, they don't only go across the border for the weekend getaway, but also for the retiring living. One of the things that as you can see when we comparing to the cost, specifically when it comes to the medical costs, for example, for MRI screening per body part per examination. So if you actually done this in a Hong Kong private hospital, it can actually have a very large range. It can range from 3,900 SEK to up to 226 SEK. However, when you actually go into the private hospital in Shenzhen or even the public hospital in Shenzhen, the cost is actually much, much lower. So they're basically, even when you receive this kind of examination in the Shenzhen private hospital, they're actually less than 6,000 SEK. And when if you go to the public hospital, it's much lesser. For example, and taking other example is the target therapy. So the cost of receiving the target therapy in Hong Kong is actually amounting to 46,000 SEK. However, but when you compare to this, when it comes to the mainland China, it's around 5,000 SEK. So that there is actually a very significant cost difference, which actually pushes some of the Hong Kong people that are flowing into Shenzhen or across the border to receive medical treatment. So beside the demand that we observe from the market, one of the things is, of course, is actually supported by the government and also the private sectors. They have been actively introducing initiative and also their policy to accelerate the growth of the cross-border healthcare services to meet the demand. So first, I will just talk about the government-supported measures. So when it comes to the Hong Kong side, basically, there have been a range of policy or measure that have been announced by the Hong Kong government primarily to support the patient transfer, the elderly care, and also to facilitate the international standard across the border. So when it comes to the patient transfer, the Hong Kong has actually introduced this support program for the hospital authority patients, where it means that like the Hong Kong patient, they can actually have an option. For example, I have a very long waiting time and I need a follow-up visit to the Hong Kong hospital, public hospital. I can actually go across the border to receive the follow-up visit in the Shenzhen hospital, so which is actually a much shorter waiting time. But then like still in the future that I still have the option to return to Hong Kong to receive the medical treatment. So that they are actually fostering this kind of support system, right? When it comes to the patient transfer, so that if I don't want to wait in the Hong Kong public hospital, then I can actually have an option to go across the border and still enjoying the Hong Kong residence rate. And also the second thing is that when it comes to the cross-border ambulance direct services, so this services has just been launched last year, so that now is actually only covering 2 hospitals, but then we are expecting them to actually expanding this scope. So what is actually offered is that for their patients in Shenzhen, they can actually directly using the ambulance service to directly transfer to the Hong Kong hospital. So for example, if I just got a diagnostic in Shenzhen hospital, and then I was in a critical stage and I don't want to receive the treatment in Shenzhen, then I want to transfer to Hong Kong, they can actually use this kind of ambulance service to directly transfer the patient back to Hong Kong. And then the third thing is that basically they are allowing the health record sharing. So basically the HA-Go applications, they actually have this kind of like medical record, not only in Hong Kong, but also in the Shenzhen hospital, which is the Hong Kong University Shenzhen Hospital. And then the second thing is that when it comes to the elderly care, the Hong Kong government is actually allowing the elderly medical vouchers. Just for a little bit information here, the elderly medical voucher is basically for the people that age 65 above. So the Hong Kong government do have this kind of subsidize to subsidize some of the private healthcare services. So and then primarily this kind of vouchers can only be used in Hong Kong clinic, but then they're actually adding the list so that they have been expanding to 19 health institute in the Greater Bay Area. And then at the same time, because as you can see that we are very short of this residential care services, the Hong Kong government, they are actually looking into way to buy the places in the Kwang Tung elderly home, so that to allow the Hong Kong citizen to actually live in the Kwang Tung elderly home or nursing home free of charge. So they are procuring the services in the Kwang Tung area. So when it comes to the international facilitation, so that as what I have mentioned already, in Hong Kong, we have 2 medical schools, Hong Kong U and then also the CUHK. They actually have opened the medical school in Shenzhen, and then they are also running 2 affiliated hospitals in Shenzhen. So basically for these 2 hospitals, they are managed by the Hong Kong professional, but then of course they are owned by the Shenzhen government. And then at the same time, the Hong Kong Academy of Medicine, they are also exploring the possibility of establishing the specialist training system across the border, so that they are trying to bring in, because one of the things between the Hong Kong and the China medical system is that Hong Kong, we are more aligned to the international standard. We have a very high standard when it comes to medical quality. Then it is also one of the ways that they are actually looking into way to bring the system into China. And then the third thing is that basically is the GBA Medical Connect system. So this is one of the key focus for the last year delegation. We are trying to understand the policy. So one of the reasons that we try to understand is that as people know that like entering the China medical market can be full of capacities, but then there are actually, for this policy they have introduced by the government, is that for the Hong Kong registered medical devices. So basically, if they see actually an urgent needs to be used in the Greater Bay Area, they can actually use this greenway to enter to the China market much faster. So if you actually apply for an NMPA normal application, it can actually take maybe a years. But then under this scheme, it's actually only took 20 days, which is actually a much faster green track. And then it's also more simplified application procedures. So they're also recognizing the Hong Kong registered medical devices. And then at the same time, in Shenzhen part, the government's actually they have identified 10 hospitals for the medical tourism that are actually seeking for the international alignment. For this, it doesn't mean that Hong Kong citizens or other citizens cannot receive the treatment in other hospital. But what it means is that for this hospital, they are more upgraded standard when it comes to the international standard. For example, they offer like multi-language professional staff. They are also trying to align what they use, what they have in the system to the international standard. And at the same time, they are opening investment opportunity for the wholly foreign-owned hospital. So primarily, before that, the China government does not allow foreign investment to run a hospital in China. But then now they actually open this up. So in Shenzhen and Guangdong, they allow the foreign capital to actually run hospital in the cities. So the implication behind all this facilitation when it comes to international standard is that basically it's actually facilitate the life science innovation into the Greater Bay Area. So also Hong Kong government, they have explicitly mentioned several times that the Hong Kong government are also looking into way to procure medical services in Guangdong area for the Hong Kong residents. Of course, we are waiting for some more detail to roll up, which is expected to be end of this year. But what is also mean behind is that it will facilitate some of the healthcare innovation into the Greater Bay Area. Like for example, if I'm a Hong Kong resident that I have been using this kind of drugs in China, but then like if I want to receive this treatment, like maybe because I'm retiring in Guangdong, then I want to receive the treatment in Guangdong, but it is not allowed to list it. This kind of medicine is not available in China, then it's actually the government will definitely look into a way to open the door up, because I don't want to use different medications just because I transferred my cases into the Shenzhen hospital. But of course, they're looking way to tackle the problem. When it comes to the private initiative, so the Hong Kong actually we can foresee different stakeholders. They are initiating different measures. First of all, is the medical insurances because basically they actually are very important, because especially when it comes to the medical expenses. So we can actually see that the leading insurance company in Hong Kong, I would say that almost all of them, they are offering this kind of Greater Bay Area medical coverage. So what it means that like if I now receive the medical treatment in the Greater Bay Area, I can actually still proceed with the claim. And also they have identified a network of network doctor in their medical insurance plans. So they're actually fostering this kind of collaborations. At the same time that we are also seeing that the Hong Kong medical group or the hospital, they are forming collaboration with the cross-border health institute, or even they are opening the hospital across the border. So one of them is namely this kind of Hong Kong style comprehensive, it's actually an eyes hospital. They're actually opening a range of eyes hospital in Shenzhen, operated and owned by the Hong Kong capital. And also in Shenzhen and also Guangdong, they also have this kind of community where there are actually those kind of Hong Kong style patients, Hong Kong style clinics. They have been running in the community. One of the things is also when it comes to the digital solutions, I would say that it could be a little bit different. the process when it comes to this is a little bit lacking behind because primarily due to the fact that the difference when it comes to the legal system, but then we can see that the government and the key stakeholder are looking way to tackle this to foster the healthcare collaborations, so that we actually see that the industries, they have launched a first cross-border medical data hub to support this kind of healthcare collaboration and research in order to enable more digital solutions in the future. So beyond all this kind of like collaboration and integration, so we can actually take Hong Kong not as a standalone market. So if you actually look into Hong Kong, we only have a 7.5 million market, where the outpatient visits is actually only 19.6 billion. But actually what is behind is actually backed up by a Greater Bay Area, which represent a substantial healthcare market, generating a significant demand for both outpatient services and the inpatient services. So that if you take Greater Bay Area as a whole, that the total demand when it comes to the outpatient is actually 615 million visit. Looking at the data that some of the demographic data, so in Hong Kong that actually among all the cities in the Greater Bay Area, we have the most serious aging problems. So 22% of the population now is actually over the age of 65, which is actually the most serious among all the cities. However, when you actually look into the doctor per population, we only have 2.1 doctor per thousand population, which is very significant, which is actually much lower than maybe a leading city in Guangzhou. So this is also one of the reasons that why we see that we have to shift the demand across the border. So now we're stepping into what are the key focus that we have identified for our Swedish company to look into. The first of all is actually digital health. This is primarily due to the reasons that we need solution to relieve our manpower demand and also to streamline the healthcare management to improve the efficiency. For example, remote healthcare, telehealth for monitoring and tracking, they are all in demand. The second is, of course, one of the key also focus is the elderly care to tackle the aging population. Solutions like preventive care for diagnostic and early detection, pain management. I would say that most of the elderly in Hong Kong, they are suffering for pain when it comes to the joint. So the pain management and pain relief product, they're in huge demand. And we are also seeing a lot of pain management clinic they're opening across the cities. The second is actually, of course, when it comes to the home care, because the Hong Kong government are trying to look into a way to shift their hospital demand to home care. So this kind of the less serious cases to the home care. So that the home care product, for example, tools to prevent the risk of falling, those products are also in demand. And also the mobility tools, connective solutions, for example, the solution to prevent dementias, and also any solution to support the caretaker will be also in huge demand. The other category is when it comes to the innovation, when it comes to the critical and chronic disease, basically to for the treatment for the raising critical illness and chronic disease. So pharmaceutical and medical device for prevention and treatment, they named specifically for heart attack, stroke, cancer, hypertension, and diabetes are all in demand. So what are the opportunities for our Swedish companies? Basically, of course, to introduce any solution or technology that can support the elderly and help to manage the aging population challenges. The second is that we will advise the Swedish company to look into a way to leverage Hong Kong and the Greater Bay Area adoptions when it comes to the digital healthcare focus. For example, to introduce telemedicine when it comes to the disease management. The second is, of course, when it comes to the caretaker, to introduce the assistive technology and training program to support the aging in place and the work of the caretakers. As Hong Kong being one of the leading biotechnology hub, so looking into the way to capitalize how to capitalize on Hong Kong biomedical innovation status. So this industry has been specifically mentioned and supported by the Hong Kong government, so that they have set aside funding to support the R&D, and also to look into the way for the GBA fast patient data and how to leverage on that to develop the precision diagnostic and treatment. Lastly, is of course to take Hong Kong as a whole, to leverage on the Hong Kong business environment, to tap into the Greater Bay Area for growth. Like, for example, to connect with the Hong Kong distributors and the medical group, because for some of the medical group, they probably have planned to actually open the clinic across the border, which can actually support companies to bring in the solution into the market. So last but not least, that we are trying to introduce one of the programs that could be of interest if you want to look into the way to how to navigate into the market. So we, Business Sweden, is organizing a delegation end of this year, 2025, from November 2024 to 26, to enable the Swedish company to engage with the key stakeholders. So this delegation is actually running in parallel with one of the GIES Summit. I can give a little bit brief introduction about the summit. So basically for this delegation, we will be visiting the government official in Hong Kong and Shenzhen to understand policy, especially when it comes to how they can tackle the increasing medical demand when it comes to the aging population. Second, we will also trying to visit the Baptist Hospital, as what I have mentioned, that this hospital have announced an expansion plan, a redevelopment plan, so that they definitely will have some procurement demand in the future. At the same time, we are trying to arrange meeting with the charity organization. Why are we meeting with the charity organization is that in Hong Kong, beside the government, the charity organization is actually one of the leading operator when it comes to the nursing home and also some of the healthcare services. For example, Tonghua Group of Hospital, they actually have run several public hospital under their portfolio, also some of the day clinic, and also a range of nursing home and also the elderly home under their operations. The other is that the Jockey Club, like for example, it can be other type of charity, like for example, Jockey Club, which actually they are one of the largest donation or investor when it comes to the healthcare services or innovations. So they make those kind of donation to the healthcare institute, or maybe they can procure some of the medical equipment and donate it to the organization that is in needed. Third, we are also trying to arrange visit a meeting with the cross-border medical group, the New Frontier Group, which is actually a cross-border group. They are headquartered in Hong Kong, but then they run hospital in China, and trying to facilitate the cross-border healthcare services. When it comes to the Shenzhen part, we are also trying to meet with the state group, where they're actually operating also some of the nursing home, also facilitating the cross-border medical services, and also we are trying to arrange visits to the elderly home. So basically, for the key objective of the delegation is to connect with the key stakeholder to explore the future business opportunity, and also to understand understand the market, as well as trying to pitch and connect your solution with the right people in the market. So lastly, we'll try a little bit more about the expo that we are running in parallel. So that basically for this expo is actually before the delegation that we are arranging. So that for this one, this expo is actually one of the leading education expo when it comes to the gerontech and also the rehabilitation technology. So they are not only open to the public, but then they are also opening to the industry, and also the government official will pay a visit to the fair. So that however, for this summit, they're actually quite selective when it comes to the showcasing solution, and also the keynote speaker they are featuring in their summit. So that for this expo, definitely you can find the right network and partnership from the visitors and also the exhibitor, and also to get insights and market access through attending or exhibiting at the explode. Last, of course, we have some more time left, open for questions. And definitely, if you want to understand how you can actually develop your roadmap in the Greater Bay Area or in Asia, or to learn more about our delegation or the potential to nominate to be exhibit at the GIES, then feel free to connect to us. So thank you.
No, I was just thinking because of the quite high difference in price of medical treatment in Hong Kong and Shenzhen. I guess that also means that the market in Shenzhen and Greater Bay Area will be of lower value, even though it's larger. But it's difficult to get good pricing when you're selling to that area, right?
I saw Sophia has a
but Stacey, I think first we can answer Anna's question about the prices. So I think it's partly due to the subsidy setup as well, Anna, when it comes to the pricing. But I mean, the procurement prices from the hospitals doesn't need to be that different at the same time. But
okay.
Of course, it's always a volume game. So the numbers Stacey showed were towards the patients. But Stacey, do you know that when it comes to the difference, if it's sort of translated backwards or if it's more from a subsidy side that it's handled differently?
I would say that at the moment, still they have a very different procurement. So that basically in China they have those kind of social. They're actually quite subsidized by the government because usually they have those kind of social security, social insurances, so that where the government you actually have if you want your medical devices to be listed in the Chinese reimbursement list, then you have actually pressed down your price by quite a substantial amount. So this is how it's actually, what I know is how it's actually work in China. But then when it comes to Hong Kong, basically it's more like we have open tenders when it comes to, but I would say that at this moment the procurement is still separate.
Okay.
Yeah, thank you for the introduction. I have a question here in terms of the percentage of population aged 65 plus. In the introduction, it says Guangzhou, the population percentage of that character is only 8%, which I just wondering when we got that data, and is that updated data? Given it might be inconsistent with data released by the local government.
For that data, actually we receive it for one of their consultation firm, but then of course they may be some of the little bit maybe that could be a little bit different when it comes to the calculations.
Yeah, I would just suggest maybe probably double check that number because it's the difference might be pretty significant.
Yep, definitely we can actually have a look on that.
Okay.
And then for Patrick.
Yeah.
Okay, if Sophia was finished with her question there, I just have a question about the next 10-year plan. When will that one start?
For the 10 years hospital development plans, you mean?
Yes, exactly.
So basically, the plan is actually started in 2013, and then now they're actually under review. So that basically the Hong Kong government has already asked the hospital authority to prepare the plan for the review to kick off for the second phase.
The second, it's not a
The
new
second
10-year,
phase.
The second phase.
Yeah. So basically for the so a little bit explanation here is that basically there are two parts. The first part is already kicked off. So which all the project are expected to be in full completion by 2028. So because the construction also take time, so that I would say that for most of the project they are expected to be completed by 2028.
So that's why I thought there was another 10-year plan. Because
yes, there is another 10 years plan.
So what you informed about building 9,000 beds, 19 projects, they are going to be completed by 2028, and we don't know anything about what is going to happen after that. Is that correct?
Let me put it this way. So the first phase already kicked off, where there are actually 5 hospital redevelopment, 5 hospital expansion, 1 new hospital. They are already built, or being built at the moment. And then the project are expected to be finished by 2023. Of course, there may be some of the procurement tendering for the new demand because some of the facilities are still being built in these few years.
Yeah. We are from NBAC, so we build technical infrastructure into the hospitals, and we don't foresee anything happening after 2028. We are completing 6 or 7 hospitals in Hong Kong right now, but we have difficulties to find out about what is the next plan. Will there be any more hospitals being built in Hong Kong, or will people actually go to Shenzhen instead to seek for care? That is what I'm trying to figure out here.
I can mention there, Fredrik, I mean, there is work being done, for example, in Northern Metropolis, a new development area in Hong Kong. We didn't cover it here, but there are hospitals being built as well. I'm not sure if those are covered in the previous one, but there are some sort of upcoming developments. I see Carrie is raising her hand as well, and that might be what she was going to point out as well.
Yes. Hello, everyone. So this is Carrie. I'm the colleague of Johan and Stacy. So, Frederick, regarding your question about the new hospital, as Johan mentioned, that in Hong Kong we have the mega project that is called Northern Metropolis, that is close to the Shenzhen border, and it's basically a mega project, and then it's covering 1/3 of the Hong Kong total area. And then in that area, the government actually have the plan that's existing hospital will have some redevelopment or expansion. And then also that they are going to build 2 more hospital in the Northern Metropolis. So, one hospital that maybe you can also share with your colleague in Hong Kong in the city called Ngau Tam Mei, one hospital in Ngau Tam Mei, and then another hospital in Hong Shui Kiu. So those 2 are the new one. And then another hospital within this Northern Metropolis that is called North District Hospital. So that will under expansion. So that is the 3 kind of like hospital project that the government will have within this Northern Metropolis. And then, of course, as Stacy mentioned that.
I just can interrupt.
Sure.
For example, Northern District Hospital, that is a contract we already have. So I'm looking for the ones that is in the early planning, where we actually can help them with design so we can get our systems in. So the projects you are mentioning, they are too late for us. I had another question as well. Elderly care, since it was 22%, what does elderly care look like from the public point of view in Hong Kong? Because I have never visited any elderly care homes in public. I mean, look at Sweden. We have a lot of systems from NBAC in the elderly care centers, and we are trying to approach those solutions to China and Hong Kong. I have no idea what it looks like in Hong Kong. Do you know?
In Hong Kong, I would say that for the, do you mean who operated the?
Oh yeah, how they build them. I mean, I've been in China. They are quite big. These, if you call it silver homes, compared to Swedish.
I would say that in Hong Kong, most of the elderly home, besides for the Hong Kong government one, basically a large number of them are running by the charity organization in Hong Kong. So namely what we mentioned, Polanco, Kwang Tung Hospital Group, and then there are also a few of the charity they are actually running for those elderly home.
Okay. Yeah, I heard that. So I just wonder if so it's nothing under the government for the elderly in that case. It has to run under charity. Okay.
Yes. Most of the demand are actually handled by the charity in Hong Kong.
No more questions.
Great. And then Ulf, my colleague, is asking when or where we will get more information about the upcoming delegation. But I guess you will provide that, and we can also share it with our network.
Yeah, I mean, we're happy to share that. I mean, it's as for all these plans, I mean, it is a tentative agenda, but we feel we have got good feedback so far, and hopefully we will lead to sort of good discussions as well. But we are happy to share that. I mean, that is also some additional information about the sort of the background not as sort of in depth as Stacey has presented today, but we're happy to share that as well, so people sort of can read up a bit more and contact us if they see interest in it.
Yeah. Yeah, just a little bit like a supplement for what Frederick said. Just a little bit data when it comes to the nursing home, the elderly home. So basically, in Hong Kong, the public side they actually have like around total is around 700 in the nursing home. Of course, we do have some of the private operator, but then I would say that their numbers is actually not really significant when it comes to the charity operated. Yeah. So is there any more questions?
Okay, thank you very much.
Yeah, no problem.
No, I guess no more questions. So I'd just like to say thank you to Stacey and Johan. A lot of useful information for all of us, and thank you for the participants also for joining. And as I said, we'll share more information by next week so that you can also get in touch with Stacey and Johan for more information about the delegation and other things. Okay.
Yep.
Great.
Thank
you for joining.
Thank you.
Have a nice
Thank you.
weekend.
Thank you.